When we're talking about a system problem, meaning that the providers in the state may not be aware of what to do for a brain injury or how to connect people to a brain injury, that almost suggests that what we have is more of a state-based problem where the providers have not yet been informed that this is a huge problem for our population. I know that there's been a screening tool that's been developed to help identify brain injury, and since that's been implemented, there have been an increased number of identified brain injuries across the board. Calling the Alaska Brain Injury Network is probably the most direct and easiest thing for providers to do, or for providers to direct patients to do, because as I said earlier, there is a central person there who can give you phone numbers and contact information for lots of different professionals and organizations. So that's always a good thing to do. When looking to determine if it's a possible brain injury, the first thing that we always advise is to do a thorough history with a patient and also look at their medical chart to see if there's any evidence that there could be a brain injury. When you have a new patient coming in and they have all sorts of unusual symptoms and they haven't been responsive to treatment, for example, and they haven't been compliant with certain kinds of treatment, and you start to think that, geez, it's just not going very well, then at that point we suggest that maybe you need to think, could it be a brain injury? And you start to investigate whether that would be a viable possibility. Bring in the family member and ask the family member about the history of the person, because if there has been an injury, then maybe they can point to a time in which they were different or better, and you can talk about what was going on at that time that changed it.
My family was never asked any type of questions after my car accident of any type of personality changes, attention changes, and so I believe the first thing that healthcare providers need to do is ask. They need to get in touch with family members soon after any type of injury may have occurred, and be asking them all different types of questions. They need to be asking them if their attention has changed. Have you noticed any personality changes?